Hi, everyone. On behalf of Chris Herbert, our Managing Director, and David Luberoff, our Director of Fellowships and Events, and the entire Joint Center for Housing Studies staff, we welcome you all to this episode in our ongoing series of events. I'm Carlos Martin, Director of the Remodeling Futures Program and member of the team that produced the report that we'll be discussing today. And before I begin, I wanted to let you know about a few upcoming events that we will be holding at the Joint Center. Next Friday, October 18th at 12:15, we'll be hosting another online talk, this time by historian Alex von Hoffman on the role that public housing might play in a new social housing system in the United States. A week after that, on the afternoon of Friday, October 25th, from 12:30 to 4, we're co-sponsoring the Ivory Prize Housing Innovation Summit, which will be both in person at GSD and online. And then on Friday, November 1st, online again at 12:15, our colleague Dan McHugh will be sharing the center's new household projections for the next 2 decades. So please stay tuned. More details on these and all our events are on our website, jchs.harvard.edu. So please make sure to go there and register for those and another series of events. Now on to today's discussion. So I started at the Remodeling Futures program over 3 years ago with two goals in mind. One, maintaining our work covering the remodeling industry, and second, expanding our scholarly scope to include a more detailed focus on the physical quality of our existing homes. The physical quality of our homes obviously creates the demand for remodeling services, but it also helps define the performance expectations that we have of our homes from substandard housing and how those bars are changing given recent expectations for things like energy performance. And unfortunately, as has come front of mind during Hurricanes Helene and Milton, our home's disaster resilience. So just as importantly, our home's physical qualities also reflect the broader history of our nation's housing, and this includes disparities by geography, by income, and by race and ethnicity. So one area that was critical in that expanded field is housing inadequacy. We've had lots of partners in this scholarly pursuit over the last year and even before. So shout outs to the colleagues at U.S. Department of Housing and Urban Development and those who produced the American Housing Survey, as well as HUD's worst case scenario. And organizations like HUD's Office of Lead and Healthy Housing, agencies like Department of Energy's Weatherization Assistance Program that have been fighting the fight and funding the resources that are necessary to help improve our homes. We also want to acknowledge the vast array of the local home repair programs that have been where the rubber hits the road. And this includes all of the local programs that help participate and inform our study, as well as the national groups, Rebuilding Together, GHHI, Habitat for Humanity, and the wonderful folks from the Coalition for Home Repair that have been leading the advocacy fight over the last several years. We also want to make sure we shout out all the academics who've been working in this space, including the pool of researchers that actually helped write this report. And one, which we'll be hearing from in a moment, Dr. Todd Swanstrom, Alan Malik from the Center for Community Progress, Austin Harrison from Rhodes College, and friends like Dr. Robin Bartram at University of Chicago, and our very own Remodeling Futures programs colleague, Abby Will, who were reviewers of our report. But a special shout out to our colleagues at the Robert Wood Johnson Foundation who helped fund this and a wide range of other grantees, focusing on the areas of home inadequacy and its consequences for home ownership and in turn, the effects on racial disparities in home ownership. So to explore whether and when home repair and improvement programs interact with each other and how they came to align or can align to better serve eligible households. This group of authors that you'll be hearing from today, partnered to prepare a white paper and hosted a series of virtual convenings going back to May 2024. And my colleague at the Joint Center, Sophia Wedeen, has taken the lead in this effort. It gives me great pleasure to introduce her. Sophia is the senior research analyst at the center, working on projects related to rental housing, residential remodeling, and affordability. And prior to joining the center, Sophia worked as a tax policy analyst at the city of Boston, so she knows from which local local programs work. And there she administered the Community Preservation Act exemption programs. She has also worked at the initiative on cities in the Boston University Department of Political Science, and she holds a BA in political science with a minor in economics from Boston University. So I will ask Sophia to join the line, and I'm happy to pass her the mic. One note, though, before she takes the mic, an additional reminder to all of you, this event, like all the others that we put on in our Friday webinar series, are intended to elicit conversation, not definitively define and end them. So please place your questions in the Q&A function, which you should see on your screen at the bottom of your screen, of your Zoom screen. And our team will be monitoring them, and time willing, we can get to the most of them before we close out in the hour. So that said, I'm passing the mic to Sophia. It's all yours.
Terrific. Well, Carlos, thank you so much for that lovely introduction. I'm going to attempt to share my screen. I guess that's the first test of the day, and I was going to assume that it's working. So thank you so much for everybody for joining me today. I'm really excited to share some of this research that we've been doing really over the past year, looking at the state of home disrepair, as well as the network of home repair assistance programs on offer. And so I want to start really just by sharing some of the motivation for this work. And this begins with the persistent problem of substandard housing. This is something that harms individuals and neighborhoods. And the deterioration of the US housing stock has been linked to a range of health problems, as well as to financial hardship and energy insecurity, disaster vulnerability, and social isolation. And at the neighborhood level, housing conditions are pretty intertwined with neighborhood trajectories and long-term wealth prospects for entire communities. So this is a really important issue. And our second reason for investigating this is that the extent of these problems and the extent of their impacts is not evenly distributed across the population. And as with so many things in housing, substandard housing conditions and their consequences fall disproportionately on people with low incomes and people of color. So this is a really important way that disparities and inequities in housing are reinforced and in some cases widened. And the third reason for our focus for this work is that we know little about the extent of home repair needs nationally. And this is especially true when we consider higher performance standards that we want to achieve for our homes related to weatherization, accessibility, disaster exposure, and so on. And it's also true because of the way that shifts such as the aging of the population and the growing impact of climate change are themselves changing what we need from our housing and what the deficits are. And similarly, there's also a pretty large gap in the literature when it comes to the current landscape of programs that offer assistance and also the impacts that those programs have. So those are kind of the important questions and ideas, I guess, that are underpinning and guiding our interest in this work. So with all that in mind, the goal of this research was basically to wrap our heads around the fundamental scope of this problem of substandard housing and the barriers to solving it. And so to achieve this, we started by reviewing the range of evidence about contemporary US housing conditions and physical performance, as well as the impact of substandard housing on households. To do this, we also reviewed the current landscape of the public and civil sector programs, ones that operate nationally and at the state and local level, and that provide repairs. And we looked at the evolving advocacy that has established these programs, as well as the evidence that points to the effectiveness of these programs. And as part of this work, we wanted to hear from practitioners of home repair assistance. And so in order to do this, we held a series of virtual discussions this past May, and we heard from home repair providers across the country operating in the public and civil sectors. And those insights helped us to understand some of the practical challenges that come with delivering home repair assistance, and ultimately underscore the need to invest in our existing housing stock. So with that being said, now I'm going to turn to our key findings, the first of which concerns this persistent problem of housing deterioration. So the Housing Act of 1979 has established this goal of a decent home and a suitable living environment for every American family. And this view really kind of establishes or established housing deterioration as both a national priority and as something that should be the basis for policy intervention and for monitoring. And when we look at the conditions of housing today, the scope of repair needs has only grown with time, both because we expect higher standards from our homes and also because there's new concerns and emerging issues. So today, concerns related to housing quality include everything from basic habitability and safety to issues like weatherization, accessibility, disaster exposure, as well as just the aging of the housing stock. And all of these we consider to be really kind of critical to this goal of a decent home and a suitable living environment. And so to drill into data a little bit more, I'm going to start by talking about what we know about the current conditions and the current state of housing disrepair. So when we're talking about poor housing quality and substandard conditions, this really just provides a very quick list of some of the specific physical problems that we're talking about. The data in this chart comes from the 2021 American Housing Survey. It's the largest nationally representative housing survey on offer that has very detailed data about housing conditions. And so this is the basis for a lot of our research. And really what this is showing is that persistent housing challenges like water leaks, hazards like large holes in the floor or large areas of peeling lead-based paint, failures of heating and cooling systems, pest infestations, the presence of molds. These are all persistent issues that exist within, a not insignificant share of housing units today. And there's a lot of diversity in those problems. And so we also see that there's a persistently high number of homes that have multiple severe overlapping physical deficiencies. The measure that we're looking at in this chart is something called housing inadequacy. This was a measure that was developed by HUD in order to aggregate severe physical deficiencies present in a home. And so homes are classified moderately inadequate if they have at least 3 or 4 significant structural problems, some of which on the list I showed you on the previous slide, and severely inadequate if they have even more structural problems, as well as things like severe electrical problems or lacking basic features like hot and cold running water or a shower or a flush toilet or electricity. So these are pretty severe, these are combinations of pretty severe states of disrepair. And what we see from this data is that poor housing conditions have persisted in the United States. And so in 2021, if you look at the far right side of the chart, 6.7 million US households lived in homes that had that were considered inadequate due to like this combination of physical problems. And this problem has persisted for both renters and homeowners alike. And when we look at who is most affected by these problems, the extent of these problems is not evenly distributed across the population. So households with lower incomes and households of color are the most likely to experience these physical problems. Overall, about 5% of US households live in homes that are in a state of moderate or severe disrepair. But that number is, of course, much higher, as you can see, for households with incomes less than $15,000 and for Black and Hispanic households. And I want to point out that these racial disparities in housing conditions are not just a product of disparities in earnings or even in wealth that we see today, and rather they also reflect a long history of discriminatory government practices, as well as real estate practices that have specifically limited housing choices for people of color, and have also steered many households, especially Black households and Black home buyers, to areas and neighborhoods and homes that with older and less adequate housing stock and a higher incidence of worse housing conditions. We've just talked about substandard housing, but many of the units that meet these basic safety and habitability standards that we just discussed still have pretty substantial unmet repair needs. And this is especially true given the aging of the housing stock. So when we take this broader look, we see that many more units are implicated in this problem. So the data in this chart comes from a study from the Federal Reserve Bank of Philadelphia, and this is one estimate of the scale of the scope of this problem. They did a study finding that around 35% of US households lived in a home with at least one critical repair need. And those needs are concentrated among households with low incomes, and the total cost to repair is almost $150 billion by their estimates. So this is a lot of housing units that aren't in a state of, may not be in a state of severe disrepair, but still have a lot of repair needs. And the scale of unmet repair needs is even greater when we consider things like energy performance, accessibility, and disaster resilience. And these are important too for the health and financial well-being of residents. And so I'll start by talking a little bit about accessibility. The housing stock in general typically does not meet the needs of people with disabilities who make up a large share of older adults. So this graph is showing data from the 2019 American Housing Survey, and really just illustrating that the incidence, like the extent to which households experience navigational difficulties within their homes increases as they age. And when homes are not accessible, residents who have these types of mobility-related disabilities are at increased risk of injury. So this repair need is, very highly linked to health and safety and well-being. And it's also an urgent issue given the aging of the population, and that this is something that's going to require more attention as time passes. Weatherization is also a really urgent concern for the housing stock, both because of the need to improve home energy efficiency and also to reduce fossil fuel-based energy consumption and expenditures. And today, many households experience different forms of energy insecurity. These can range in type, but often involves households having to forgo basic necessities, fall behind on their utility bills, or simply having to leave their homes at unsafe temperatures due to the inability to use the heating or cooling equipment that they have. So this is another severe deficit of the housing stock that certainly compounds affordability challenges for households, and that also just needs to be the target of repair intervention. And then the final consideration, of course, is disaster exposure. As Carlos mentioned, this has been deservedly in the headlines for the past week, given the unimaginable damages we've been seeing in North Carolina and in Florida. And recent Joint Center estimates showed that about 60 million homes are located in areas with at least moderate risk of environmental hazards, at least moderate exposure. So when we think about the full needs that it would take to repair the housing, to repair existing housing, and also mitigate against future disasters, this is the kind of thing we also need to take into account. So that was kind of a whirlwind overview of the extent of the problem of housing deterioration. And so now I'm going to turn quickly to the effects. So housing deterioration harms individuals and communities, and it's linked to a range of pretty serious negative outcomes for people. And so a lot of this research comes from the health literature, highlighting ways that housing conditions such as poor ventilation or overall structural quality could cause chronic health issues like asthma and respiratory infections. Another example of the ways in which homes can hurt our health is the fact that any home that's built before 1976 could have lead-based paint in it that children can ingest. So those are just some quick examples of the health impacts. And poor housing quality can have financial consequences too. When households with lower incomes do make the investments needed to remediate these problems and pay for repairs, they may experience pretty significant financial strain and housing instability as a result. And then when they don't make those investments, of course, they're missing out on wealth building opportunities as a result of not being able to invest in their in a household's greatest asset, which typically, if you're a homeowner, is your home. Now, these effects manifest at the neighborhood level and tend to be pretty concentrated within certain neighborhoods. And research has linked substandard housing to housing instability at the neighborhood level, and has also indicated that dilapidation and deterioration within one housing unit can have a depreciating effect on other properties within that neighborhood. And in addition, housing decline is also manifests as a type of racial and environmental injustice. And housing decline and environmental hazards and health outcomes tend to map on pretty well onto racial geographies across the country. So this, just one quick example, comes from a study in like a childhood asthma study out of St. Louis. The first map in this chart is showing the share of units built before 1950. The second is showing the share of people of color, and the third is showing the childhood asthma rate. And you can see that these are pretty similar maps, and that's indicative of the way that these disparities often manifest at the neighborhood level and disproportionately affect communities that are lower income and people of color. So this is another way that disparities can be perpetuated through substandard housing. And so now I'm going to turn to talk briefly about the state of home repair assistance, which is the other big bucket of our work. And the first point that I want to highlight here is the way in which the ecosystem of home repair programs is diverse, but also extremely fragmented. So what does fragmentation look like? Well, so programs differ very widely based on the characteristics of the households who are eligible for assistance, as well as the home performance or quality target, and how the programs are administered. So income is almost always part of the criteria for eligibility, although other characteristics of a householder, such as their age, whether they have a disability, whether they're a veteran, as well as sometimes their geography, if they're located within a certain neighborhood, can often be a qualifying characteristic, especially for municipal home repair programs. And home repair programs are often focused on one single target, which could be something like habitability or accessibility, and usually focuses on a specific deficit or a home performance standard that a home is not meeting. And finally, these programs vary significantly in terms of the size of their budgets, as well as their output and the number of households that they're able to help and the depth of the assistance that they're able to offer, as well as the ways in which they offer assistance through loans, through grants, whether those are forgivable, and so on. And so in order to understand the contemporary landscape of home repair assistance, we conducted what I will boldly call a very thorough review of the current home repair assistance programs on offer. So this is a pretty overwhelming chart, and I encourage you to read our paper because we do go into detail about all of these programs. But I wanted to highlight that this is a fragmented, diverse landscape, and that there are programs in the public sector operating federally and at the state and local levels, and in the civil sector operating nationally, and then with local branches, and then also more local programs that are providing all types of home repair assistance. And some of the big ones, obviously HUD and CDBG, or HUD, CDBG, and the home program, the weatherization assistance program you might have heard of. But there's quite a bit of diversity in terms of the types of repairs that these programs offer, the number of households that they help, and the scales at which they operate. And so in order to understand some of the challenges that these programs face, as well as why they're like, what are the consequences of this fragmentation, we spoke to home repair assistance providers. This past May, we had 3 virtual discussions with them, as Carlos had mentioned. And they provided a lot of useful insight about the challenges that they face. And so these challenges, I guess, fall into different categories. Some related to the fact that these programs are simply under-resourced. Pretty much every home repair provider that we talk to pointed to the fact that these programs are oversubscribed and typically don't have the capacity, in terms of staffing or the funding to deliver the type of assistance that they need to. Moreover, differences in eligibility criteria, especially when it comes to federal programs, can either prevent or just strongly disincentivize coordination between programs. Another challenge that they pointed to was, of course, the fragmentation, which can lead to duplication or gaps in benefits. And then finally, capacity challenges, and as well as like legal restrictions on data sharing, make it hard for these programs to reach out for households who might be eligible for assistance. And those same challenges also hinder efforts to coordinate and collaborate between programs. And really the upshot of all of this is that these constraints result in gaps in coverage. If you're a household and you live in one place with one set of housing conditions and your income and your income is one thing, you could receive assistance in one place and not receive assistance somewhere else. So the results again is gaps. The workshops also highlighted, or the workshop discussants, I should say, also highlighted a lot of really interesting, notable efforts that home repair providers are undertaking given this very fragmented and ultimately very constrained landscape, in doing everything they can to deliver assistance given these constraints, given these limited resources. And I've grouped these into kind of four categories or four themes around of discussion. The first being that programs administrators are hard at work trying to expand outreach. This can include things like improving methods for screening households more efficiently. Oftentimes municipal department or programs have like there'll be multiple municipal departments that can assist households with home repairs. So even if they're not served by one department, they can make it easier to share that information so they can still get assistance from somewhere else, either a different city service or perhaps a nonprofit that's also operating in that area. Programs are also working to combine and layer benefits. In some cases that's allowed legally, and also just overcoming barriers that around restricting the duplication of benefits. Home repair providers have also been working to share resources across programs and combining things like home inspections, home access and construction management services, sharing contractors, basically ways to make the most out of their resources and use those most efficiently, as well as other initiatives, including improving case management and offering technical assistance and so on. And programs are also, home repair providers are also hard at work piloting new efforts and innovations in order to maximize their reach and the number of households that they can help. And so some of the themes that emerged from that discussion included things like universal applications, where homeowners can just submit their information to one place, especially at the municipal level. And if one program can't serve them, they're in the database and they can be helped by somebody else. And so centralized databases were another thing that they discussed as a potential solution to this data sharing problem and to the idea that we need to get more households able to access assistance. Other things they discussed were the need to, or I guess opportunities to combine funding streams from multiple federal sources when it's possible. Also to improve opportunities for labor training so that the skilled workforce that physically does this work will be available to do it. And then also just to monitor the outcomes of these programs and invest more in research and studies that can really point to program efficacy and effects. So in conclusion, what does this all mean? I think if I had to summarize, I think what we heard from home repair providers is that the current state of investment in home repair interventions falls really short of need. This is something that came across again and again in the workshop discussions that we held, and it's also reflected in the data. Given the persistence of these issues and the consistently high number of households dealing with these really severe physical problems in their homes that they don't have the money to remediate on their own. Now, home repair assistance programs are doing everything that they can given this constrained environment, and they don't have the resources that they need in order to deliver the assistance that they want to. And so part of what we need to do, and what I hope this paper will do, and what future research certainly needs to do, is to increase the evidence base. A lot of the issues that I talked about today, especially the consequences of housing deterioration, are not visible to the public. These are things that happen within the home, and the health impacts, the impacts on mental health and well-being, the financial impacts are not physically apparent and sometimes might not be appreciated. And so for that reason, we need more research, more data, and really more attention to drive home the fact that this is a critical issue that affects people across the life course and affects the trajectories of households and of communities. And ultimately, we need a greater investment to ensure that people have a safe and decent place to live. I think that has to be a core goal of policy. And so now I'm going to turn this back over to Carlos and then I believe to Todd, because the one thing that I have not mentioned is that we also reviewed the state of, we also reviewed the evidence concerning the effectiveness of these programs. Spoiler alert that they work, and you'll hear more about that from Todd. Thank you very much.
You spoiled the surprise, Sophia, but yes, that's exactly correct. And we're very grateful to have one of the co-authors on this report join us. I should say, I was trying to keep up with all the questions. I was doing so well. Then all of a sudden, sort of the floodgates were opened, and we have a huge set of questions that are coming in. So thank you. Keep them coming as I introduced our next guest, who is Dr. Todd Swanstrom. So Todd is the Desley Professor of Community Collaboration and Public Policy Administration at the University of Missouri, St. Louis. And prior to joining UMSL, Todd taught at St. Louis University and Rockefeller College of Public Affairs and Policy at University of Albany. Todd, like Sophia, not only has strong academic cred, but also he worked as a neighborhood planner in Cleveland as a director of strategic planning for the city of Albany, New York. So these are people who understand how local government works, as well as understand the scholarship that is needed. I definitely want to note that Todd's book, The Crisis of Growth Politics, Cleveland, Kucinich, and the Challenge of Urban Populism, that was published in 1985, won the Best Book Award from the Urban Section and Policy of APSA. And he has co-authored Place Matters, Metropolitics in the 21st Century in 2014, which won the Michael Harrington Award from the New Politics section. And in 2011, he published a co-edited volume, Justice and the American Metropolis, from the University of Minnesota Press, which develops this idea of thick injustice that I think has informed his most recent book. Yes, Todd publishes many books in 2023, which he co-authored, named The Changing American, called The Changing American Neighborhood, The Meaning of Place in the 21st Century, which was published by Cornell University Press. So Todd has a wide range of urban politics and public policy research interests, but he currently has been focusing on housing deterioration as a form of environmental injustice and its prospects for the anchor strategy to turn around in disinvested neighborhoods. So it's a great pleasure to have you on, Todd. I'm going to pass the mic to you to elaborate on some of the points that Sophia just introduced.
Thank you, Carlos, for your overgenerous introduction. I want to thank JCHS for initiating this national conversation about housing deterioration and home repair. As Sophia said, it's an issue that needs much more attention, needs to be put much higher on the political and policy agenda in this country, I think. Let me just say a few words about how I got involved in this issue. About 3 or 4 years ago, the Vacancy Collaborative here in St. Louis approached researchers at the University of Missouri, St. Louis, and asked us a couple questions. What is the extent of housing deterioration in St. Louis? How much would it cost to repair it? And does this cause housing vacancy? And we looked around for the data and we found out that there is no data at the city or neighborhood level that would allow you to identify the extent of housing deterioration and how much it would cost to repair it. We did come across the study that Sophia mentioned done by the Philadelphia Federal Reserve using the American Housing Survey, but we needed to have data that could get us down to the city and neighborhood level, and the AHS does not allow you to do that. So we luckily got a grant from the Foundation in Chicago, constructed our own questionnaire, so we're able to estimate the amount of housing deterioration based on people's experience of their home. We mailed out 2,500 questionnaires. My name was put on the first page of the questionnaire. If you have any questions, contact Professor Todd Swanstrom at the following number. And I asked our survey researcher, am I going to get a lot of phone calls? And she said, oh no, don't worry, Todd, you'll just probably get a few. Well, I got over 200 calls. We were pretty clear that this was about research. We didn't necessarily have funding, but people are so desperate. And if you heard those calls, they would just tear your heart out. People are really having a difficult time, especially in the low-income neighborhoods. Often older African-American women, sometimes widows, whose houses are collapsing around them and they don't have the means to fix them up. So it's a very serious issue and it really needs much more attention. And in the Q&A, I'd love to talk more about what Sophia mentioned, how we measure this, how we make this visible, a problem that is to a great extent invisible inside a home behind closed doors. So my role in this event today is to talk about the chapter in our report on the outcomes of home repairs and home repair programs. There are few, if any, really gold standard evaluations of home repair programs. You can imagine randomly assigning people to an experimental group that got home repairs and a control group that did not get the repairs would be troublesome, probably legally, but also morally, to consign people who need home repairs to not getting them for a significant period of time. So it's very little, almost no such randomly controlled experiments to evaluate home repairs. The alternative is, on the one hand, we can ask people, well, who got home repairs, did it make a difference in your life? How did it impact your mental health, your physical health, etc.? We can also, and Sophia mentioned, there's a large literature in the public health field, track health problems, tracing them back to conditions within homes and showing what a difference it would potentially make if we corrected these conditions. And finally, we can use existing research to take a certain housing deficiency, for example, black mold, and say that if we were able to eradicate it, how much would that save in foregone expenditures? And the big expenditures, of course, would be in healthcare for Medicare and Medicaid. So I'll talk about these different approaches to evaluating the effect of home repair programs. There's also a certain complexity in what you might call the independent and dependent variables. That is, the independent variable, the repairs, is itself complex, as well as the outcomes are complex. The independent variable, the repairs, vary all the way from the most minor home repair to major gut rehabilitation. So you have a lot of variation here. In this report, I focused on repairs that can be done while people occupy the home. So it's repairs only up to a certain point, obviously not a gut rehabilitation of the structure. It's also the case that there is no standard repairs. I mean, the repairs are almost by their nature idiosyncratic and vary a great deal. In our study, we created 42 repair scenarios, which can begin to standardize the field. Obviously, it's going to overlook a certain amount of detail, but will give us an ability to talk about certain standard repair scenarios, which I think might help in the long run in being able to pin down the effects of housing deterioration and home repairs. With regard to the dependent variable, that is what is the outcomes of home repairs? As Sophia mentioned herself, there's a lot of different outcomes. It can be outcomes on the physical health of the residents, which could be things like asthma and lead poisoning. It could also affect society more broadly in Medicare and Medicaid. There's mental health effects, anxiety, depression, and of course, this affects mental health costs and workforce participation. Financial health affects the individual household in terms of their household wealth, their property values, their utility costs, which can be quite high for people who do not have an adequate envelope, secure envelope in the home. And that affects the broader society, of course, because it impacts neighborhood property values and the local tax base. There's also stability and independence. A big factor in the research on aging is the people's ability to age in place and to have physical mobility and access to the structure. So that affects individuals that way. And that, of course, affects society more broadly in terms of housing vacancy and the cost of demolition. And finally, it affects community. It affects our relationships with our neighbors. In our interviews with folks who received home repairs in St. Louis, we found that some of them were embarrassed to invite their family or their neighbors over because they had a leak in their living room. And then once they had the repairs, they could begin having those community relationships again. So it affects how community cohesion and housing affordability. So what do we know about the effects of home repairs? On the one hand, there's a very large literature, which I've spent a considerable amount of time exploring from public health scholars. It's often peer-reviewed, very solid literature, but it proceeds usually from the particular health outcome back to the housing condition that causes it. So, for example, it may look at lead poisoning and, of course, look at the effect of lead paint on lead poisoning, or take a look at asthma and tracing back whether asthma is caused by conditions with a home of excessive moisture and black mold. And also falls are very important, and whether modifications and accessibility modifications can improve things. And this literature, by the way, shows a remarkable benefit cost ratio. That is to say, for relatively small expenditure, according to most of these public health literature studies, we could save much more money than it would cost to do the repair. I think in the case of one study which estimated that if we installed lead-safe window replacements for all pre-1960 housing, which would be a very expensive proposition, obviously, the overall net benefit above cost would be $67 billion. So this literature suggests that there's a good return on our investment. In terms of the evaluations of existing home repair program by housing policy specialists, one way, as I said, is self-reported. In St. Louis, we did a survey of those who received home repairs and asked them questions like, do you feel that you are a lot, a little, or no more likely, or even less likely to age in your home following the repairs? And by the way, 71% said they are a lot more likely following repairs to age in their home, to stay in their home. Part of this is you can do this with a survey, but we also did it with qualitative interviews. And that's where a lot of really dramatic evidence came out of the effect of home repairs on the people's quality of life. Things like being able to invite your family over to your home because of the home repair. There's also been cost-benefit analyses done, and the one in particular I'm thinking of was commissioned by Rebuilding Together. And what they did is they looked at 71 separate scholarly studies on the causal impact of housing conditions on outcomes like physical and mental health, financial well-being, etc. And of course, the premise here is if the repairs eliminated that physical deficiency, then it would reduce the negative outcome and save X amount of money. The conclusion of this report is that for every dollar contributed to Rebuilding Together, there's $2.84 in social returns. In other words, the return on investment is $2.84 for every dollar contributed. Kind of wish you could make that kind of return in the stock market, right? Most of that, by the way, was savings in Medicare and Medicaid, $1.32. So just the medical savings. So how can we sum this up? It's a rather complex and somewhat messy set of empirical findings. I would say the first point is that home repair programs have a substantially positive ROI, return on investments. I would say this, that the Rebuilding Together study, which it admitted was not fully comprehensive at all, and it's not able to monetize many benefits from these programs. For example, social relationships. What does it cost? What does it mean financially if you can now invite your friends and your family over for dinner? What does that mean? It's very hard to monetize that, but those things are real. There's many such factors like that. Also, as Sophia mentioned, these home repair programs are addressing an historic injustice in our society. Housing deterioration is an economic, racial, and environmental injustice. It's unfair that people bear these burdens through no fault of their own, through historic practices in the housing market that left them in neighborhoods without the housing equity to be able to fund home repairs. And finally, as Sophia said, we need more research. The research that we did in St. Louis, which was able to bring it to light, helped to jumpstart the formation of the Home Repair Network, which in about 1 hour I'm going to meet with as part of their advisory committee. So we need more research that can really pin this down and make the invisible visible. And we also need policy process evaluations. As Sophia mentioned, it's an incredibly fragmented space. There are 15 separate federal programs funding home repairs. There's large administrative overhead in some of these programs. How do you target these programs to need? How can you, as one of the people we interviewed in the home repair space in St. Louis said, their work is trying to adapt these programs as the funding stream comes down to the real needs of people on the ground. And that's a lot of work for people on the ground to do that. So with that, let me stop and turn it back to Carlos.
Thank you so much, Todd. And thank you again to Sophia. The number and quality of questions that we're receiving is quite impressive, and our team has been trying to categorize and merge some of these questions. But while I have you both on, I do want to take the prerogative as the moderator to ask a little bit more about some of the my questions that I have for you. And for you, Todd, in particular, I know that there's some really interesting stuff that's happening in St. Louis and the home repair network that you're involved with. And so definitely want to ask you about that, because many of the questions that I've seen popping up are about where are the programs? How do we find out about programs? Where are the programs? Do we have a list of all the home repair programs? Which and in some of the responses to other questions, I've given you links to other blog posts that we've put out where we've tried to identify places where we looked for home repair programs. And so I'm sorry, I'm already answering the question, Todd, but I do want people to know that there are some other blog posts that we put out over the last 1.5 years that can help identify this. But also to note that so many of the programs are civil sector, and they're not necessarily long-term, long-funded municipal repair or state-funded repair programs. And so in many cases, a repair program may pop up, and a couple of years later, the nonprofit dismantles, right? So Todd, I don't know if you want to talk a little bit about what you see nationally, but also focus on St. Louis.
Sure. Well, it's a serious problem in St. Louis. People call into a program and we tell them, well, you should call the so-and-so agency. They call the so-and-so agency and they get back to them. And then there's yet a third provider that maybe they're eligible for if they're a veteran or whatever it might be. To make a long story short, they get lost. They may be 6 months later have never even applied for benefits. The waiting list is 2 or 3 years long for most of these programs in St. Louis. So what in our policy reform agenda that we created, one of our goals is to have a centralized intake process, somewhere where you would go no matter who you were or what you needed in terms of home repair. You go to this one place, and then they will direct you to the proper provider. So that is essential. And we find that a lot of our programs of having to kind of mix and match and combine. Somebody can only do minor repairs. Well, what if Mrs. Smith is, you do the minor repair, but she's got a hole in her roof? We can't let that go on. So we're trying to coordinate that. So I guess, here in St. Louis, for example, we're grateful to the president of the Board of Aldermen. They put together a kind of 20-page pamphlet. Here are all the home repair programs in St. Louis, right? And here's where you contact, and here's where you're eligible. And we're putting that up on our webpage. So hopefully you can, do this, kind of aided by web links, right, to get to the right place. So it's a huge problem, Carlos, and we need to deal with the existing system and try to make it work for people, but we need to also reform the system. And frankly, the fact that we've got 15 rivulets of funding coming down from the federal government makes it incredibly difficult for people on the ground to make it work for people in a cohesive fashion.
You've already sort of started answering some of the other questions that were coming in around what are the best practices for people, knowing that there's so many programs with wait lists, right? And so that it's hard even for households to identify where they should be going to. But then once they're on a wait list for indefinitely or taken off the wait list or never even able to access the wait list because the wait list only lasts a 2-week period, right, to even sign on to it. So certainly what we've noted in the report that we did was that some of the best conduits are local trusted community organizations that can help navigate individual households. But one of the strong trends that we saw and that you noted is this ability for other city programs to refer their clients to them and for the city repair programs to note them. So you have somebody who may be eligible for weatherization, finding that they get referred to a repair program that'll fix the roof before they get the energy efficiency installation. So that kind of streamlining of municipal databases. And there are several folks in the Q&A who've talked about their local programs. I saw a shout out to Houston, who talked about their ability to streamline. We know this is also happening in places like Pittsburgh, and quite a few other places. So thank you for that. And we'll definitely want to talk a little bit more about that, but I do want to pose one question that came out of both of your presentations, and I want Sophia to join in on this one too. And this issue of data, that do we actually know what the magnitude of the problem is, based on the fact that one, in St. Louis, you have to do your own survey, right? Because American Housing Survey has historically been underfunded. It can only do a certain sample size that's nationally representative, not locally representative. So we don't actually know how bad the problems are in different places and how they vary by different household types. So maybe Todd, you could start off, and then I'll pass it to Sophia.
Oh, I think this is a crucial issue. One of the serious gaps in the AHS is, and according to the American Housing Survey, you need to have a functioning heating system, but you don't need to have a functioning air conditioning system, to have an adequate house, right? Well, when we talked to our local partners when we were doing our study here in St. Louis, they were insistent that air conditioning is not a luxury, it's a necessity in St. Louis, and especially for older homeowners, older people. So we identified in St. Louis asking questions about air conditioning, and it gets a little complicated because there's overlaps here, but to boil it down, I'd say somewhere between 15 and 25% of older homeowners in St. Louis do not have adequate air conditioning. Either air conditioning fails periodically, or the envelope they have so much air leakage, right? That they often, when the air conditioning is on, it does not keep them cool enough. Some of those people are going to die in the next heat wave in St. Louis. We know that. So that's a serious deficiency that aren't really even to measure that even with the AHS, right? So what I think is needed is for groups locally to kind of do their own research, right? And to dig into this problem locally. And we have this survey instrument, we have this up on the website. We'd be glad to share. There are 11 different documents on how we conducted this study, right? It's not, I don't want to minimize the cost. There is a certain amount of cost involved, but it's relatively affordable. You don't have to send an inspector into every home, right? You can ask people about their experience of their home and therefore get some sense of what the problems are. So I think we've got a long ways to go here. And finally, I'll say one other thing, which is qualitative interviews are powerful. I mean, we found in our advocacy in that when somebody tells you what it meant, right, they had an electrical box that was sparking at night, and they didn't sleep. They couldn't sleep because they would hear literally this box sparking, and they got that fixed. They could finally get a good night's sleep. I mean, those are the kinds of things that's hard to put a dollar figure on, but are very powerful. So you also need to do, along with quantitative research, the more qualitative research. Sophia, let me turn it over to you.
Thank you. I have several thoughts about this. So I guess I'll start with actually. So the plus and the minus of the American Housing Survey. So why do we use the American Housing Survey? It's the largest nationally representative housing survey that asks a lot of questions about the physical conditions of homes. So it is the best data on offer, and nationally it can be useful for things like understanding trends over time, or anytime you want to look at a crosstab and see the extent to which these housing problems, whatever is being measured, the extent to which they're impacting different groups of people differently. So that's kind of on the one side, like that's the benefit of this data. Of course, one of the biggest drawbacks is that we don't have reliable subnational data. And so many of these problems, and I'm not even talking about metro level, but so many of these problems manifest at the neighborhood level, or like at very, very small geographies, in specific parts of the country, in specific neighborhoods of specific metros, where that have been shaped by systemic disinvestment and segregation. And so the problems are very concentrated. And so even if the American Housing Survey is, sampling stuff at random, it's not going to understand or it's not going to be able to detect a lot of those like really severe neighborhood effects that especially kind of accrue in neighborhoods where there's like a high concentration of these physical problems. So I think that's kind of a core data limitation for sure.
And to add to that, because of those data limitations, I mean, we certainly can't track things like fair housing violations, like where the houses are getting the services, which houses have applied and can't access services, and those that are eligible but simply haven't applied. So all that level of detailed granular information has been a challenge for us. I do want to
I just wanted to add one more
please
thing
do.
I remembered my second point. So the other thing, of course, that this is missing. So we have data about housing conditions, but we don't, that data cannot be directly linked to the impact of those housing conditions on households. So if you have a household with a higher income, maybe they're in a position where they're able to fix whatever the issue is. Whereas for more vulnerable groups or for people who, let's say, like it's an older household or somebody with a disability, the physical conditions of their home could have like could have a different and much more severe impact on them. So even if we are understanding physical conditions, there's still kind of this missing piece where we can't quite link the data about the physical conditions to the effect of those conditions on individuals, which of course is what home repair intervention has to be able to target. Like that's the problem.
And to follow up on that with you, Sophia, so many questions came in about who was able to access home loans and financial systems. And certainly one thing we do track in the Remodeling Futures program is how many people actually use finance, right? Rather than just their own cash or savings or their own credit cards, or products retailers to credit card, right? To be able to do the services. If you can just talk about that. And the reality is that very small proportion of people actually use finance.
Right. Yeah, not many. Yeah, I think it's more than 3 out of 4 or 4 out of 5 among homeowners who decide to undertake and are able to undertake any kind of home improvement project are using cash from savings. So the extent to which people are using financial tools at all or other than just cash from savings, or it's already very limited. And there certainly are trust issues. That was another thing we didn't get into, that a lot of homeowners are understandably reluctant about a loan program, worrying for justifiable reasons about their own finances and what that could mean for them. So there's, I think, a lot of work that still needs to be done to kind of like build the trust around that and also just increase education about different financing options.
That's right. And that was the only point that I think all our participants from local home repair programs in our workshops were completely split on. It was literally a 50-50. Some people saying we definitely want to tie in and provide finance, work with banks and other lending institutions, community financial institutions to offer more loans because many of our clients want them. And the other half saying absolutely not. There's no trust in the banking institutions to help provide with these loans. So 2 more questions given the time we have. And Todd, I'm going to ask you the next one because there are some good questions about home repair in the context of all the other housing policies that we have and the fact that they're in many ways, home repair has been one of the arrears, one of the lesser attended to children in housing policy. And certainly our colleague Alan Malik fought the good fight as the final chapter in our report. If you can expand on that a little bit more about how you see this playing out in the bigger scheme.
Yes. Well, if you take a look at housing policy, how much we invest as a society in housing, most of it goes to demand side subsidies, which is Section 8 and vouchers, and to LIHTC. LIHTC is the largest production of housing, affordable housing in the nation. So in that sense, home repair programs are kind of an orphan in the policy universe. They haven't gotten the large pots of funding over the last 20, 30 years. You know, when the block grant was initiated in 1975, it reached a peak funding in 1979. Since then, it's down 80%. in inflation adjusted dollars. In fact, even more probably now. So that was the main program to fund home repairs. That was in 1975. That was that whole idea. We're moving away from urban renewal and tearing things down to this block grant to preserve us. And cities that have older housing stock got more funding. So that program has become underfunded over the years. And let me just kind of make this link between this data discussion and this question of policy priorities. You know, there's a national conversation about housing affordability for good reason, right? It's a huge problem. It's being discussed in the presidential election. There's clearly an effort to do something about it. It's clear that the supply of housing is not keeping up with demand, and we're seeing a horrible problem with affordability. The problem is that housing quality and housing affordability have been treated as separate issues. There's not a discussion of housing quality at the same time that we talk about housing affordability. And frankly, our de facto, our policy, our affordable housing policy process in the United States is to build new housing for higher income households, often on the fringe of metropolitan areas, and let the older housing filter down to lower income households. And in fact, in order for some housing to be affordable, it must deteriorate to a certain point, to the point that it becomes affordable, right? Well, what does it mean that you're spending less than 30% of your income on rent or on your mortgage, but the home is inadequate and unsafe? That's not affordable housing, right? So we're severely underestimating the affordability problem, even as it is, because we're not taking into account quality. So we need to, make this more visible, make this more evident, and and begin to correct the imbalance in the housing policy system. Karen Black, who spoke just a few minutes ago at the Reclaiming Vacant Properties Conference here in St. Louis about these issues, said that in Philadelphia, they used the phrase, the best affordable housing is the home people already live in. The home they live in is affordable housing. We need to preserve that affordable housing, right? We need to invest in it. And I think it hasn't gotten enough. And I think finally, one of the problems in the home repair space is that what we've learned by doing interviews here in St. Louis and talking to folks, a lot of home repair programs only get compensated after they do the work, right? They repair somebody's home and then they submit the voucher and then they get paid. There might be a 3 to 6 month delay in this payment. Well, small nonprofits and small contractors cannot sustain that. They can't afford to not have money coming in for 3 to 6 months. So we find that there's another problem in the home repair space, which is there's not funding for the infrastructure of home repair, right? For the staffing, for the organizations, to keep the lights on, to do the processing. So there is an imbalance in the policy system that way, that there's not funding to provide the infrastructure for home repairs, and not just to do an individual home repair, right?
Yeah. And because we're at time and there are dozens of amazing questions that are lined up, we do want to make sure that people make sure you read the report and continue pursuing your lines of questions with us. We are happy to answer them offline. But I do want to note some at least root seeds of hope, since we've identified such a huge problem. And I think part of the hope is that we do see other housing policy and program that isn't necessarily directed towards housing quality, caring about home repair and maintenance, right? A lot of questions come in about homeowner education, like pre-purchase counseling, to make sure people understand all the challenges that are going to be faced when they purchase a home. There are questions about title and ensuring clear title, particularly for multi-generational family homeowners that may not be able to access some of the formal programs, and the things that have been learned from, for example, disaster recovery in terms of temporary proof or sufficient proof of ownership to be able to access some programs. But I do want to note that there is a movement to create broader funding and resources to the home repair assistance programs that we've been talking about. Sophia has been tracking the Pennsylvania whole home repair program very diligently, and we've been noting several of the federal proposals to expand that Pennsylvania, Commonwealth of Pennsylvania case to the whole country, particularly led by many of the advocacy groups that may be joining us, as well as the Coalition for Home Repair. So on that note, we hopefully are leaving you with a sense of the problem, but also some spirit of hope to address it. And I'm sorry we're at time. Thank you so much for all the amazing questions. We will attempt to figure out a way to respond to all of them. But thank you. Thank you to Todd Swanstrom and to Sophia Woodine and to our co-authors and reviewers for the paper. Please read the paper. It's a good one. Bye, everyone.